Good afternoon, good morning, good evening, wherever you are. Welcome to today's event, which will be exploring public expectations of healthcare in Asia Pacific. My name is Arun Sudhaman. I'm editor-in-chief at PRovoke Media, and we're very happy to be collaborating with Sandpiper Health on today's event, which will focus on a new study, the Sandpiper Healthcare Tracker, an analysis of public expectation in Asia Pacific. The research examines people's healthcare priorities and satisfaction with healthcare services and what this means for policymakers and healthcare organizations more widely. As you probably don't need any reminding, the importance of healthcare policy has come into sharp focus as the world continues to battle the COVID-19 pandemic. And of course, the research is a springboard to discuss wider challenges and solutions, the role played by communications, the importance of collaboration, the patient voice, and much more. So thank you all for joining. Before I introduce our wonderful panel, a couple of housekeeping notes. Please feel free to ask questions via the Q&A option here on Zoom. Ask them at any time. We'll try to get to them towards the end of today's discussion. Please note that we are recording this. Please look out for coverage afterwards. Please feel free to share widely with your networks. Before we get to the research, let me quickly introduce our panelists. So presenting the research, we have Saskia Kendall, who is director at Sandpiper Health. She'll spend around 15 minutes running through the research findings. We will then discuss the findings with our panel, which features Dr. Ritu Jain, who's a board member at DEBRA International, also serves on the boards of the Asia Pacific Alliance of Rare Disease Organizations, Rare Diseases International, and International Rare Diseases Research Consortium. And she's also a sociolinguist at Nanyang Technological University. We have Kylie Park, who's head of corporate affairs for Amgen in Asia Pacific, where she leads Amgen's communications and advocacy strategy. And we have Robert Magyar, who's a director at Sandpiper Health in China, where he also leads the life sciences team. This session will run for 60 minutes, so please do stay tuned. And with that said, Saskia, let me hand over to you, please.
Thank you so much, Arun, and thank you everyone for joining us for this really important event to discuss public expectations of healthcare services in the region. Next slide, please. So this is a really exciting opportunity for us to talk about this research that we've actually been doing for the last 2 years. But I just wanted to take a step back and talk about why it is that we've embarked on this research project. We know that expectations and prioritization of healthcare is changing over time. We know that we have an aging population in Asia Pacific. We know that there's an increase in a variety of chronic diseases, and this is driving changes in the way that we are thinking about healthcare. But when we looked at the amount of data that's available in what the public's expectations are in the region, we felt there was a really limited amount of data and a limited amount of insights into something which really should be driving healthcare policy. So we thought this is a really good opportunity to really get under the skin of the issues of healthcare in the region. So in 2019, we embarked on this project. We have the Healthcare Tracker is based on a survey of about 12,000 people across the region. I'm trying to understand what their changing attitudes towards healthcare are. In 2019, so just before the beginning of the pandemic, we looked at 6 different territories and asked questions of people in those territories, which are middle to high income countries. And then we did the same survey again in 2021. So we looked at a few more territories to really understand a broader understanding of demographic and regional changes relating to people's prioritization and expectations of healthcare services. And we also were able, because we were able to do it over 2 years, to see what the impact of the COVID-19 pandemic has been on people's prioritization and expectations of healthcare. Next slide, please. So what did we find? We looked at how much people are prioritizing healthcare in comparison to other public policy priorities. And we saw a dramatic shift in people's prioritization of healthcare between 2019 and 2021, which was almost certainly driven by the pandemic. So healthcare in 2021 was a top policy priority in almost all territories that we checked. So that's 10 out of the 11 territories. And this was a dramatic change from 2019, when healthcare, although a top priority in many places, only about half of priorities, half of the territories had healthcare as a top priority. Outliers, Australia really felt that healthcare was the #1 priority in 2021. It was also the #1 priority in 2019, so that hasn't changed. It remains to be a really important priority for people in Australia. But we also saw in Hong Kong, Japan, the Philippines, and Singapore, healthcare ranking as the second most important policy priority after the economy in 2021 in these territories. Next slide. We also looked at satisfaction in healthcare services and how these might have shifted due to the pandemic. Satisfaction is a really good way to measure whether or not health services are actually meeting people's expectations. So we looked at satisfaction, and across the region, we found that an average of 61% of people were satisfied with public healthcare services and 62% in private healthcare services. However, we saw dramatic shifts and a huge regional variation in levels of satisfaction. In terms of the highest satisfaction, Singapore had the highest satisfaction of all of the territories we looked at. And we also saw a massive jump in satisfaction rates between 2019 and 2021, an almost 17% jump in satisfaction, up to 82%, which is an incredibly impressive, very surprising jump in satisfaction. I think we can safely assume this is due to, particularly due to the Singaporean response to the COVID-19 pandemic. It has been largely successful. Mortality rates have tended to be quite low, and the impact on healthcare services has been really limited. On the other end of the spectrum, we have Indonesia, which saw the biggest drop in satisfaction over the last 2 years, almost 20% drop in satisfaction with public healthcare services. So from 71% to 50%. And again, I think this is almost certainly due to the COVID-19 pandemic and how it has ripped through the country, the impact that it's had on healthcare services, how much pressure and severe impact that it's had on healthcare services and in terms of mortality. Although we didn't look at sorry, could you just back one moment? So in the Philippines, in 2021, they had the lowest level of satisfaction. We hadn't looked at them in 2019, but it should be an area for concern for policymakers and healthcare leaders that the satisfaction rate is that particularly low. 29% is something that really should be looked into. Oh. Could we turn off the music? Thank you. Okay. Next slide, please. So we asked also about the reasons for satisfaction. Healthcare quality, cost, and access to care all play critical roles in satisfaction. What was the main driver of satisfaction? The #1 reason for satisfaction was the level of healthcare professional expertise. And this in some ways isn't necessarily a surprise. People value their healthcare professionals and trust in them is very high when you look at general public attitudes. So this is something that should be thought about in terms of what should be kind of prioritized, but also people's ability to access care was something which made them satisfied. In terms of drivers of dissatisfaction, cost came out the highest. In 10 out of 11 territories, cost was the main reason for dissatisfaction, but also a recognition of the difference in healthcare services that provided in different territories. People's ability to access care was also a main reason for concern and dissatisfaction in people. So really, it's a double-edged sword in some respects across the region, and recognises the importance of it. Next slide. We also asked people what their opinions were about who should be paying for healthcare services. There are a lot of different healthcare financial systems across the region. So there are a variety of different reasons. So things that we can be focused on. But what we found is that overwhelmingly, government was most responsible, or viewed as most responsible for financing healthcare systems. There were some differences across the region. In Australia, this figure rose to 80%, probably recognising the very well-established public health system in Australia. But also there was a slight increase in expectation in some areas. So in Malaysia and in China, we saw quite significant increases in expectations that government should be paying for healthcare services. However, interestingly, in some territories, there were minor drops. Singapore, for example, their expectation that government should be paying for healthcare services actually dropped by about 5%, which is statistically significant. Next slide. So we, as well as asking whether or not healthcare should be prioritized, we also asked people what should be prioritized in terms of healthcare and in terms of funding and resources by government across the region. What came through very strongly was that healthcare infrastructure funding was really important and seen to be a key priority. 63% of people highlighted it as something that should be a priority. This was followed by prevention of ill health and access and investment in medical technology. There were outliers, Japan, for example, where people prioritized prevention of ill health above hospital infrastructure. And in Singapore, interestingly, people prioritized making care more affordable. Next slide, please. We also asked whether or not what specific disease areas should be prioritized in Asia Pacific, asking people to identify their top 3. So what came out very clearly is that cancer was a top priority. This was true in 2019 and in 2021. People in 9 of the 11 territories believed cancer should be a top priority for government funding. And particularly their concerns were around the severity of the disease, the significance, and the cost of treating the disease. But the pandemic has also really affected people's attitudes to infectious disease and the potentially infectious disease outbreaks. This wasn't necessarily a surprise to us, but really these had come up in the top 3 in most places that most of the territories that we actually surveyed. Just to mention as well, although these were the top priorities for people, other kind of more chronic diseases also came through. Although not necessarily the top priority, other disease areas, often kind of chronic diseases, also made it into the top 3 for most people, but all in very different ways. And the top reason for that were their personal experiences of these diseases. So this is something to be thought of in terms of the nuances of prioritizing different disease areas. Next slide, please. Alongside understanding these expectations, we also thought it was quite a good opportunity to see who people viewed as playing a major role in fighting the COVID-19 pandemic. We asked about a number of different organizations. What came through the strongest was that government had played the highest, the strongest role in combating the COVID-19 pandemic, followed quite closely by healthcare professionals. But also there was a real recognition around 60% of, almost 60% of people across the region, that pharmaceutical companies and bringing the innovation that they brought to overcome the COVID-19 pandemic was had played a really critical role in the fight. So this potentially is a major opportunity for pharmaceutical companies to understand and recognize the importance of this reputational change for them. Next slide, please. So what do all these findings mean and this data means? We've kind of highlighted 4 key recommendations that we think are critical. Most importantly, improving access to care is really important, and all stakeholders working in healthcare are part of the solution. And it's important that healthcare organizations are collaborating and supporting policymakers to improve access. We also think that the patient voice is really critical. Understanding, as you can see from the information that we've shared, understanding the priorities and the experiences and attitudes of the people that are using services is really important. And this is something that I think we continue to find challenging in the region. And so it's important to think about how we encompass that patient voice in policymaking, in development of service delivery, and development of kind of models of care. Also important is thinking about how we engage with patients, how we engage with them in terms of helping them understand their conditions, engage with healthcare, their prevention and disease management. So this is a really important thing to focus on. And finally, kind of underlying all of these things is a recognition that given the level of satisfaction, given how much people are prioritizing healthcare, we really need to think about how we are developing and strengthening healthcare systems so that they can be sustainable in the long term. We strongly recommend that this is actually something that all stakeholders should be involved in and actively collaborating in, including kind of policymakers, health service providers, pharmaceutical companies, and a whole host of other stakeholders in order to be able to develop health systems that respond to the needs of patients. So that's a whistle-stop guide into our research. So thank you, Arun. Over to you.
Thank you very much, Saskia. Yeah, some really interesting insights there, and we will we'll get into many of them, I imagine, in the discussion to follow. As mentioned previously, please do pose any questions you might have in the Q&A box, and we'll try to get to those as well. But if I could start perhaps by asking each of our panelists for their initial responses to the findings that were perhaps most pertinent to them, that interested them the most. I can give you each around 3 to 5 minutes. And Kylie, if you don't mind, I'll start with you, please.
Sure, thanks, and thanks for the research, Saskia, and for taking us through it. I think it's always really important to have these really good data sets contributed to the overall policy discussion. So well done and congratulations. I think from my perspective, the prioritization of healthcare is not a surprise. I think we have seen that in various pieces of research that that has been done over the last little while, certainly since COVID, and I think that change in priority from perhaps pre-COVID to post-COVID with healthcare being really elevated is not unsurprising given what we've all been through. I think, from my perspective, a couple of interesting data points to come out of the research. One is this ongoing prioritization around hospital and infrastructure. And again, I think that could be a reflection of our experience with COVID, where that was probably, very top of mind for a lot of people, particularly in our region. I think going forward to the points that Saskia made about the importance of resilience it's important that we think about our healthcare system more from the perspective of a predict and prevent model. So how can we actually improve the health stock of our community overall, so that in fact, you know, we are better placed to withstand these sorts of health shocks going forward by making sure that, you know, that people are prevented from becoming terribly ill in the first place. And I think, you know, that's where the importance of innovation, prevention, making sure that as we continue to see aging populations, that those people are kept well and able to, you know, contribute, make a contribution, but also withstand some of the health shocks that we've unfortunately seen over the last little while. I think also encouragingly for us as a sector is just this wanton willingness that appears to work more collaboratively, and to sort of you know, this increasing understanding that not one sector can achieve all of what we need to achieve, be it governments, private sector, NGOs, that we really do need to work together. And I think from our perspective, to see that come through in this research is also very encouraging.
Thank you, Kylie. Yeah, I think the point on kind of building resilience by adopting a, you know, more of a predict and prevent approach rather than break it and fix it, I think, as you put it, is really, you know, something I think that will continue to be such a critical factor for healthcare systems as we look into hopefully a post-COVID future. Ritu, over to you. Curious to hear your thoughts on the research.
Hi, Arun. Thank you so much. It's a real pleasure to be here. And I must say that I'm absolutely blown away by this report, primarily because it is so fortuitous that it sort of spans this very critical juncture that I guess globally humanity has faced, one of the more critical junctures and so centered on health. So pre-pandemic and post-pandemic data that allows for a comparison and almost like a longitudinal study. I can't really say post-pandemic because we're still in the midst of it, but imagine the value that this data will be able to contribute in terms of assessing health systems and potential reactions and preparedness for future pandemics, or any other health crisis for that matter. But having said that, I'm also very mindful that we've learned lessons that regardless of the criticality of situations that we're faced with, we tend to forget these lessons too fast and we end up repeating. So this report, I think, really highlights that health cannot any longer be deprioritized in national plans. Health is the core of society. It has, you know, a virus, a pandemic has brought the entire globe to its knees, entire humanity to its knees. So we have to definitely critically focus on health as a priority across the world. And as Kylie just said, I think the key to that, especially for Asia Pacific, is collaboration. No country, I would say, with quite a degree of confidence, it's a very big claim, but no country in the world, and certainly no country in Asia Pacific, can claim to be self-sufficient in terms of health and cannot take preventive measures, if that's even possible, without collaborating across stakeholders, across countries, across regions. We need a whole world approach to healthcare, but we certainly need to do some critical examination of how and where we can collaborate to perhaps minimize the impact of such crises.
Thank you. Yeah, I think both of you have made the point about collaboration, and perhaps we can talk a little bit more about what that collaboration actually can look like, has looked like, and maybe should look like. But before that, Robert, let me come to you to get your perspective, because these are, you know, some of these issues are things you've worked across now for many years across this region.
Yes, thank you, Arun, and also thank you for the other speakers. It is my pleasure to be on this panel with you. It is an interesting study, and you know, the results are somewhat surprising for me as well. I think, you know, when you look at, for example, the satisfaction level in some countries related to healthcare, it is surprising how high they are after 2 very difficult years. And obviously, it's not only healthcare policies that make, you know, this a very complicated situation, but I'm still positively surprised by the satisfaction level. So what this tells me in one way is that good policies and communicating about, you know, the work that healthcare providers and policymakers and pharmaceutical companies do, it does work. Having good communication and, you know, having good policies is recognized by patients and the people. On the other hand, I think we are also facing a situation that if you are standing still, you know, you can provide good health care, but if you are just standing still, that's not going to be very, you know, it's not sufficient. It's not going to be recognized. So you always have to improve. And this creates a situation for all of us, you know, for governments, for companies, for healthcare providers, when you always have to improve, and it puts obviously financial burden on everybody. So that problem is not going away. I think, you know, I agree with everybody that it's very important to work together, kind of minimizing the burden, whether it's the disease burden or the financial burden. But this is a long-term problem that we will all be facing. So the other element that I find interesting is that, you know, people recognize the value in prevention. And I really do believe that prevention and the education around health, whether it's to the public, to patients, to caregivers, to our healthcare providers, is very important, because that is the only way really to minimize the financial and the disease burden that is in front of all of us. So I agree, you know, with my fellow panelists, you know, thinking about that this is really a job that no one can do alone. You know, it's a big ecosystem. You have pharmaceutical companies, you have, of course, the patient groups who are, you know, helping and growing and strengthening in the region, but you also have to work with insurance companies, with, you know, local governments, with medical associations, and so on and so forth. A big job for everybody.
A big job. Let's talk a little about that point. The importance of innovation and prevention, which rank as kind of lower priorities in terms of spending compared to hospitals and infrastructure. Kylie, you flagged this as well. You know, the sort of break it and fix it approach is expensive, places pressure on health systems, is not necessarily geared to keeping people productive and well. So how hard of a communications challenge is this to make perhaps innovation and prevention a higher priority in terms of what people expect from healthcare spending? And how do you see that communications challenge being tackled?
Well, I think, you know, we need to go back to some core communications principles. And, you know, I'm sure many of us on this call started life as reporters and journalists. And, you know, as a young reporter, you often go into a big story and you have no idea what it's about. And there's a lot of complicated information. There's a lot of complicated briefings. There's a lot of very serious, you know, senior and serious people giving you information. And it's really important to be able to digest and really look for those key data points or key points of the story that are going to resonate, and then be able to articulate that in a relatively simple way. And I don't mean simplifying the message, but, you know, I tend to talk about the importance of 3. You know, what are the 3 things that I want to say about this issue that may start broad and may get me down to, you know, the nub of where I want to talk to. I think if you look at some of the communications that have come out about COVID recently, and then in the early days as well, it was very complicated. It was often very confused. There were mixed messages in the media. I think had some authorities in the early days taken a very simple Q&A approach, or taken a very simple kind of, step 1, step 2, step 3, not in any way kind of negating the enormity or the complexity of the issue. But I do think that as a journalist, you often have to take a deep dive into a very complicated situation and emerge with, with your 4 paragraphs or 5 paragraphs or 1 minute 30 story. I'm an old television journalist, so forgive me for, I'm not even sure people talk that way anymore, but that is really our job, is to be able to digest and then come back with a very clear story. I think as communicators, there will often be pressure on us from other stakeholders, be it internal or external, to include a whole lot of information. But the more that we can have that first paragraph or infographic in the back of our head when we're actually regurgitating the story, honestly, I think the better. And again, I don't want to underplay the sophistication of the message or the complexity, but I do think that is a strength of a good communicator, is to be able to bring forth that information in a very clear way. So it's a challenge. But if we go back to our first principles as communicators, then I think we will be well placed to tell that story going forward.
Thank you. Yes, the value of simplicity when it comes to communication, I think, can never be underestimated, and certainly not when we're dealing with issues as critical as these. Ritu, over to you. I wanted to get your take on something that I know is kind of integral to your work here, which is the patient voice. And I don't know if there's anything in the research that jumped out to you about the importance of the patient voice, but how do you see that changing perhaps in this region? And do you think it needs to be perhaps afforded more attention?
Absolutely, Arun. This is something that we have been, when I say we, I'm speaking on behalf of rare disorders. That's very close to my heart. I'm not just a caregiver to family members with rare disorders, but also a very passionate advocate of rare skin disorders, of epidermolysis bullosa, and of various rare disease alliances in the region and around the world. So in my line of work, I'm pretty sure that you can all sort of understand and empathize with the fact that rare disorders, given the very rarity of these conditions, you would seldom find access to healthcare for people with rare disorders, because there are very limited resources and facilities with that are not just is there a huge lack of access to healthcare for rare disorders, but also affordability and expertise. So often we find, and I'm being very kind here when I say often, if I would prefer to use rare, do we find that we can find expertise in healthcare settings for people with rare disorders? So in that case, it's the patient who knows more about their condition than doctors do. And I totally understand that challenge, because given how many rare disorders there are, how many medical students can we teach about rare disorders, and how many doctors would actually see a patient with a rare disorder in their lifetime of practice? So expertise is very challenging, and I would say an impossible goal to aspire for when it comes to rare disorders. So what's your option but to listen to the patient, who is really the expert? And I come across this again and again. Doctors say to me, so are you saying that we should put patients in the driving seat of their care? And I have to say, yes, you do have to do that for rare disorders, because as it is in the Asia Pacific, we have such a paternalistic healthcare system where doctors know best. So we're trying to subvert that and say, you do not know best about rare disorders. Just admit it, be humble, treat the patient, if not as the expert, then at least an equal partner, or at least give the patient with rare disorders a voice in the health system. So without the patient as a partner, I am confident that no healthcare system can succeed. And if you take just the example of rare disorders, then I would go beyond and say, all healthcare systems need to consider patients as partners. Let me give you a very brief example. If you think of epidermolysis bullosa or any other rare disorder, the common person might say a cure is a priority. Yes, it's a priority for any health condition, but ask a patient and they say the cure may be 5, 10, 20, another lifetime away. I want something that improves my quality of life today. I want you to provide something that stops the itch, that prevents me from sleeping, from living, from eating, from doing anything. It's disabling. I want an end to the itch. I don't want a cure. But would you think that? I mean, I don't think that till I spoke to patients. So that's, I mean, I can go on for hours and hours, but really without involving the patient in every aspect of healthcare, from the design of clinical trials, from HD assessments, from delivery of healthcare to assessing the impact of healthcare, you cannot any step of the way do it without patients as partners.
Yeah, very, very good points. The importance of patient voice is something that I think perhaps is overlooked to a certain extent in this region. And I know when we've talked about this before, you've mentioned, you know, there are sometimes language and cultural aspects at play as well, which we can maybe get to. But let me come to you. We've heard obviously the importance of the patient voice, which is sometimes underplayed. You talked about how important collaboration is, and Kylie noted, you know, the basics, I guess, in terms of storytelling as a means to tackling some of these challenges. How do you advise government and companies to better communicate about innovation and the work that they may be doing to improve patient care? Because it seems as if that's one of the critical challenges here.
Collaboration between industry partners and patients, is that what you're asking me, Arun?
Yeah, that's the question. I was going to come to Robert first with that question, and then I'll come back to you if that's okay. Thank you.
Sure, Arun. I think, you know, that's a very valid question, and I would just like to jump back for 1 second to what Ritu said, you know, regarding the patient voice. It is absolutely important that, you know, it be included in the discussion. They are one of the most important stakeholders in any discussion about health. But I've also seen, you know, when you have patient groups and organizations who don't really have the capacity and the knowledge to actually do what you would expect them to do in terms of communicating what they need, and, you know, or using resources that, for example, government or other, you know, stakeholders might give them. So capacity building in terms of the patient voice is very, very important. And, you know, I would advise both government and the corporate, you know, the businesses who are working in healthcare to think about that very closely and to work with the patient groups, because it's not just going there and asking, you know, what are your needs? There, you know, we talked about infographics, we talked about different channels that they need to use so that the policymakers and the companies actually, you know, get the message, right? So that's one. And similarly, you know, for businesses and for the government, clear, transparent communication is very, very important. And I'm maybe a little bit traditional when I think about corporate communications, but, you know, often I see that there is a large expectation on the part of the public that companies should resolve all the problems in the world. And, you know, when you speak to a small specialist medical device maker, right? And you, obviously they want to focus on their product and how that can help, for example, patients or treatment or healthcare professionals, you know, questioning them about sustainability or questioning them about much bigger issues. Those are important issues, but they shouldn't be really you know, the main objective of communications coming out from these companies. Just to give you an example, I know, you know, companies who healthcare companies who are doing forestry-related projects in some parts of Asia because they think that this is very important, so that they are seen as a responsible corporate, actor. Yes, it's important, but if your business is healthcare, let's try to focus on healthcare. And you can talk about the fact that there are kind of sections between sustainability and environment and healthcare, but I still think that often, companies have a very large burden on them or very large expectations on them. And, the government is really key here because they have to make sure that, all of these stakeholders and all of the messaging comes together in sound policy. So they have, the hardest job almost, but I think they have to recognize that, again, this is not something that they can do alone. You see many countries in the region, I think, who very smartly work with innovative companies, responsible companies who have programs that really benefit patients and caregivers and the public at large. But again, I would advise that, companies and government should really focus on the main objectives of the issues that they are trying to resolve. I often feel it's just, becoming a very, very kind of crowded space, what they are talking about.
Thanks, Robert. I just want to come to you first before I come back to you, Ritu, because I want to get both points of view from Robert and Kylie in terms of incorporating patient voices more effectively. And it seems like, it seems obvious, right? Listening to patients is something that underpins research when we're talking about satisfaction and priorities and so forth. Kylie, do you think that is a challenge for the corporate sector? And how do you see them addressing that? Is it just about capacity building, or is more required?
For patient groups, you mean, Arun?
Yes. Yeah, in terms of listening to patients and collaborating more effectively with patient groups.
I think it depends on the need. I think that, and first of all, full credit to Ritu for her comments just recently. I couldn't agree more in terms of giving those specific examples about why the patient perspective is going to be slightly different often from the clinician's perspective. Just very well said, and we should never lose sight of that. But I think it really depends on the situation. So you're absolutely right. In the Asia Pacific, definitely, it's not so much capability or capacity. What we see is that a lot of patient groups are very focused on, quite rightly, delivering care and support and often even financial support and emotional support, but are not necessarily quite ready or feel it's appropriate for them to be, more active advocates as you may in potentially Australia, where I am obviously from, and some other markets. So, and then I think for the company, it's actually being very careful around, how our support can help to guide that and to ensure that, we're not in any way suggesting that they do the work of the corporate, but actually help them to be able to advocate on behalf of their patients. So things like, good government relations, not lobbying. Lobbying is not a word really that we use very much anymore. It's good relationships with governments to enable those conversations and to Ritu's point, inform governments about what's required. Good communications skills, as Robert said, just some fundamental expertise about what it takes to do a good social media campaign, or to tell a good story. And then obviously, there's potentially a role that we can play, particularly as large multinationals, with all of the, the processes and systems and governance that we should all have in place. There's often a way that we can even help to give some of that information to patient groups that are perhaps struggling to decide what kind of entity they want to set up, or how they should, how they should even order themselves. So I think there's a lot of ways that we can support, even beyond financial assistance. And sometimes these other types of support are even, more needed than some of that more transactional financial support.
Thank you, Kylie. So Ritu, back to you. I mean, is this the kind of, I suppose, the collaboration that you're looking for from your perspective? And do you see perhaps other challenges as well in terms of language and culture?
Thank you, Robert and Kylie. I have to say that it's refreshing to hear concerns as well. And I think we are nowadays a little too polite and we don't voice our differences and our disagreements the way, you have hinted at very gently here. And I totally hear you, Robert, because sometimes I lose sight of the fact, because I work for and with such a successful patient organization, that I sometimes forget the lack of organization and capability and capacity, as you both referred to, among patients in the region and across the world, actually, across different conditions as well as across different countries. But I do think that there are multiple ways for various stakeholders to collaborate. And right now, since we are focusing on industry and patients, I will give examples of that. And forgive me, but my examples are going to be mostly from DEBRA International and DEBRA Singapore, both organizations that I currently chair. And so just to give you a very small example of DEBRA Singapore, which is a very small DEBRA. DEBRAs we have DEBRAs in more than 45 countries in the world today, with DEBRA International being a very established and I would proudly say the best patient organization in the world. But we have, I would suggest that, for organizations like ours, what I would say to industry is, instead of working with individual patients, perhaps encourage patients to have alliances, single condition national alliances, and go one step beyond and have single condition regional alliances, like we have with the Asia Pacific Rare Disease Organization, which I used to head until last year. And so with these organizations, we encourage patients to work together so that their unified voice becomes an attractive partner and an entity that industry may want to collaborate with, because as you said, you have scarce resources too, and you can't squander them on individual or tiny groups who may not have the resources and capacities. And it is our responsibility then, DEBRA International, for example, as well as a part of the Asia Pacific Alliance, we provide training, which I think would be a bit of a it would be an issue of compliance if industry were to engage at certain levels with patient organizations. So enable patient organizations. I think, Kylie, you might have hinted at this, or I may have misunderstood, but what kind of support do you give other than money? I would say build certain priorities and require patient organizations to have a strategy plan that translates perhaps into providing better care to patients. Yes, that's always a priority, but something broader like skills and training that patient organizations can benefit from in terms of simply enhancing their communication ability, their ability to advocate for their needs and priorities. We're not lobbying, or you're not lobbying, but patients know what they want to advocate for, what their priorities are. So definitely there are so many ways to enable patient organizations, patient voices, when they come together, can be a very, very powerful resource. With DEBRA International itself, we partner with some of the leading researchers and research universities and research entities in the world. I would say we contribute more money to EB research than any other entity does in the world. Some of the leading research is funded by DEBRA International or by individual DEBRA groups. We have clinical practice guidelines for patients. We have clinical practice guidelines for specialists, doctors, and we provide training for doctors and specialists. The list is really endless to the extent of services and resources that patient organizations like DEBRA can provide to patients themselves. I don't think today we are in a position to expect governments to be fulfilling every need. That's a bit of a romantic aspiration if we expect just governments to be fulfilling our healthcare needs. So the more we partner with patient organizations, the easier and more distributed our tasks become.
Yeah, and that's a really important point. Whether we consider it romantic or not, it's the reality. I think, although the research is not necessarily conclusive on this, because I think 7 out of 10 people in Asia Pacific believe that government is financially responsible for healthcare in their territory. I think many markets in this region are kind of making that shift. But almost 6 out of 10 people recognized pharma companies as being one of the major players in the fight against the COVID-19 pandemic. So, all right, we lose track, but we are 2 years in to the pandemic. The pharmaceutical companies have really rallied, I think, to the kind of unique challenges. And this is a sector, let's say, diplomatically perhaps, hasn't always had the best reputation or the best perceptions amongst the public at large. So Kylie, if I can come to you, pharma companies have been recognized for their role in overcoming the pandemic. How do they ensure perhaps they don't squander the reputational benefits of the past 2 years?
I think for me, and I've been discussing this even with my own team in the last couple of weeks, I think, we always had collaborations. We always, certainly from my company's perspective, and particularly in this region, we had some really good examples of where we were, really leaning in to support implementation of certain policy that, that governments may have identified, particularly around the area of phone health and so forth, which, we're really proud of. And then, of course, we had COVID, and it was much more sort of practical assistance. Obviously, many companies providing direct support through, the development of vaccines and so forth. But then others just really helping out with, e-health, direct to patient sort of clinical trials to enable all of this to for the wheels to continue to turn. I think going forward, from my perspective, there is an opportunity for us to probably be a little more braver, to be a little more courageous, to really look at this research that's coming out, yours and others, which really does demonstrate that not only is there a role for us to play, but in fact the community expects us to play a role. And I think for us that almost provides kind of a bit of a wherewithal, Arun, to sort of say, okay, we need to take a seat at the table. We can take a seat at the table. There may always be some that are uncomfortable about working with the private sector or pharmaceutical sector specifically, and that's okay. That's fine. They can courteously decline, or we can courteously step away. But I do think that for us, we need to get more comfortable at taking a seat at that table on our own 2 feet, and to really bring to bear some of that extensive expertise and knowledge that we have to really support the overall policy discourse. So, we hear a lot about public-private partnerships. We hear a lot about alliances. To be more specific, I think it is good when companies actually work together, because I think that sort of shares, that sort of shares any sort of risk and really does help to ensure that this support is indeed truly independent. That won't always be the case, but I think wherever possible, we would certainly advocate multi-stakeholder, that the support be multi-stakeholder, and where possible have multiple companies engaging.
Yes, the point about collaboration again, and indeed it sounds like what you're advocating for is just for a more proactive mindset rather than perhaps a reactive approach, which may have been perhaps what has traditionally been favored. Okay, we've got 5 minutes left. If anyone has a question, now is your chance to please ask it. And meanwhile, Robert, let me come to you on that same point that Kylie discussed about the pharma sector's overall reputation. How do you see, I suppose, the path forward for them? You already talked about how important it is for them to not get too distracted by other issues and causes. But how can they ensure that they are, I suppose, addressing these challenges in a way that continues to
yes.
Sorry, how can they ensure that they're addressing these challenges in a way that they don't squander the reputation benefits that they may have accrued?
Yes, I think that's a very good question, and I agree with Kylie. There is no easy answer. For what I see from my work is that every time you have a new vaccine or a new innovative treatment, a new drug, a new medical device that comes out, and it's a technological or scientific or therapeutical breakthrough, of course that creates a lot of positive messaging and a lot of kind of good reputation for companies. But then the next question is always, how expensive is it, right? And that question basically ensures that there is a negative connotation almost to everything that relates to healthcare. Now, I do think that this is a difficult issue, but there are ways to focus on really the benefits, focus on not only the disease related and therapy related benefits, but also the economic benefits of new treatments. And I really do think that governments have to be also engaging in a responsible communication about this very, very complicated sector, very complex in terms of, the technology, the innovation, and the finances, right? And I would even say that, patient groups might also want to be part of that discussion, because of course, the financing of therapies, of drugs, of devices affects them the most. So finding innovative solutions for that, and then, I jump back to collaboration again, is, you have to do that together with everybody. And I think patient voices recognizing that factor and would create an environment where governments also have maybe a better understanding of how these issues interrelate and not always just slam the potential cost. The one other thing I will say is that working with the different stakeholders, and Ritu's comments were, I think, very important, is obviously crucial. When I was talking about capacity building earlier, I really meant that capacity building in collaboration with the government and with the industry. I didn't mean in any way that, patient groups need to, get better on their own. This is definitely, I understand it's very difficult. So, in the past, I have worked, for example, with the American Cancer University, bringing their people over to Asia and helping groups to build capacity. Also, obviously, Sandpiper North Head in China. We are a business, but we have done pro bono trainings for patient groups on communications and other capacity building work. So, this is not an easy area, but there can be steps made and progress made, if we all work together. And I really appreciate, both the comments that Ritu and Kylie made in that direction.
So we're almost out of time. We've got 1 minute, but Ritu, I will give you the final word on this particular topic we've just discussed. Do you see an opportunity for pharma companies? Do you think concerns about cost will continue to perhaps, bedevil perceptions of them and broader public concerns?
Absolutely, Arun. Costs are going to go up. We've already seen that. And while we can wish that governments should take care, and we would like governments to take care of all healthcare expenses or some other entity, that's simply not possible. And if that were to happen, and we're already seeing it, it's going to translate into higher taxes and other kinds of cuts that ultimately will percolate down to the health consumer. So yes, definitely, I think that industry can play a critical role in, once again, I come in with examples of rare disorders. And we simply don't have products for most rare disorders currently. But where we do have neither insurance companies nor most governments in the Asia Pacific are willing to pay for these very, very exorbitant health products. I think there's a huge space here for dialogue with industry and governments and patients to come together and see how can we bring down costs. We have to be practical and see industry is not here, as Robert reminded us, to improve the climate or do some kind of charitable work. We're all here with certain agendas in mind, but if we can come together and find a middle ground, I think we can definitely find creative, innovative solutions. And rare disorders shows us the way to go. I mean, in Singapore, we've managed to have conversations with industry, bring down the costs of certain products in Singapore, provide health. What's the phrase for it when companies provide patient access programs in certain countries? So while they do offer some of those, we also have to understand that they have commercial needs, and how can we better fulfill those across a region, across a nation, across a population of a certain condition globally. I have so many examples, and I'm very happy to share that at another point, but I am absolutely convinced that there is the only way to go is to have a multi-stakeholder conversation on bringing down costs.
Quite right. And it's good to hear the level of optimism in this conversation about that too. And I do think that the research demonstrates that we are kind of moving into a new era, perhaps, in terms of how people, what people expect in terms of healthcare, what their priorities are, and that can't be a bad thing. Let me thank all of you for your time, and in particular for really insightful responses that simplified what I think are some quite complex conversations around healthcare policy, healthcare priorities, healthcare services, and what all of this means for policymakers and healthcare organizations. We could keep going on, I think, for quite a while. There's so much to discuss here, but I think this session has provided a really useful insight into the research findings, and I'm hopeful that everyone here will maybe spend more time with the research. This video will be available, so you can share it, rewatch it, and we will be producing a story on this conversation as well. So thank you all for participating. Thank you to our panelists as well, and thank you very much to Sandpiper for their excellent research report.
Thank you, Arun.
Thank you.